Welcome back to Prime Age Health Hub, everyone. I'm so glad you're here because today we're diving into something that every single person over 60 should pay attention to. You see, there's a medication that millions of older adults take every single day to control their blood pressure. On the surface, it seems harmless, even helpful, because we all know that high blood pressure can be dangerous. But what if I told you that this very pill, the one that so many doctors prescribe, without hesitation, could actually raise serious risks for seniors? I know that might sound alarming, and believe me, I don't want to scare you unnecessarily. My goal here is to give you a clear, honest, and completely understandable picture, so you can have an informed conversation with your doctor or healthcare provider. So, if you're over 60, or you care about someone who is stay with me, because the information I'm about to share could make a real difference in your health. Now, before we get into the specifics of the risks, let's take a moment to understand why blood pressure medications are so common. Hypertension, or high blood pressure, is often called the silent killer because it can damage your heart, kidneys, and brain over time without giving you obvious symptoms. That's why doctors are quick to prescribe medication to keep it in check. But here's the catch. Not all blood pressure medications affect older adults in the same way. As we age, our bodies change. Kidneys don't filter as efficiently, liver function can slow down, and all metabolism isn't the same as it was in our 40 seconds or 50 seconds. That means that a pill that works fine for a younger adult could potentially cause serious side effects in someone over 60. And here's the part that often gets overlooked. Some medications may even increase the risk of falls, dizziness, dehydration, or other complications that are far more dangerous than high blood pressure itself. This is exactly why it's so crucial to know what you're taking, why you're taking it, and what signs to watch for that indicate it may not be right for you. So what exactly are we talking about? Without naming brands, which I'm avoiding for safety reasons, there is a class of blood pressure medications that, according to research, may elevate certain risks in older adults. The effects can range from mild to serious. For instance, some of these medications can lead to electrolyte imbalances, which is when your body has too much or too little of vital minerals like potassium or sodium. That might not sound dramatic, but it can cause muscle weakness, irregular heart rhythms, and even confusion. Confusion is especially concerning for seniors because it can lead to accidents or make it harder to manage other medications correctly. And then there's the risk of low blood pressure or hypertension, which might seem like a good thing at first glance. But in reality, if your blood pressure drops too much, it can increase your risk of fainting or falling. And as we all know, falls in older adults are a serious issue. They can lead to broken bones, hospitalization, or even long-term disability. This is why it's so important not just to rely on numbers on a chart, but to understand how your medication is affecting your body in real life. You might be thinking, well, I've been on my blood pressure pill for years and haven't had a problem. And that's exactly why this is so tricky. Often, the negative effects build up gradually and subtly. You might notice more fatigue, a little dizziness when you stand up too quickly, or mild swelling in your legs. Individually, these symptoms might not seem alarming, but they're signals from your body telling you that something might be off. The problem is that because blood pressure is such a silent condition, doctors and patients alike often focus exclusively on the numbers, not on how the patient actually feels day to day. And unfortunately, by the time serious complications arise, it can sometimes be too late to reverse the damage. That's why awareness is so critical. Because knowing what to look for, talking openly with your healthcare provider can prevent small issues from turning into life-threatening problems. Finally, I want to share some practical tips that don't involve guessing or make abrupt changes to your medication on your own that would be dangerous. First, keep a daily log of how you feel. Note any dizziness, fatigue, or unusual symptoms. Second, schedule regular check-ins with your doctor, and don't be afraid to ask questions like, is this medication still the best choice for someone my age? Third, maintain a lifestyle that supports healthy blood pressure naturally. Eat a balanced diet rich in vegetables, fruits, and lean protein. Stay hydrated, engage in gentle exercise appropriate for your ability, and manage stress through meditation or breathing exercises. These habits can sometimes allow your doctor to use lower doses or fewer medications safely. Remember, the goal isn't just to lower your numbers. It's to live a healthier, more active life without putting yourself at risk. Now that we've laid the groundwork, let's dive a little deeper into what the research actually shows about the blood pressure medications and why they can be riskier for people over 60. You see, studies have consistently shown that as we age, the way our bodies process medication changes significantly. Enzymes in the liver that break down drugs slow down, kidney filtration decreases, and the balance of electrolytes in our blood can fluctuate more easily. What this means in plain language is that a medication that seems perfectly safe at a certain dose for someone in their 50 seconds might be too strong for someone in their 60 seconds or 70 seconds. And because the effects don't always manifest immediately, it's easy to assume everything is fine until you start noticing subtle changes like a bit more fatigue than usual, occasional dizziness, or even just feeling a little off in the mornings. These minor changes can be easy to dismiss, but they are actually signals from your body that something isn't quite right. And the scary part, if ignored, they can lead to much more serious complications over time. One of the most common risks seniors face with certain blood pressure medications is something called orthostatic hypotension. That's a fancy term for when your blood pressure drops suddenly when you stand up or move from sitting to standing. Imagine you're getting out of bed or rising from a chair and suddenly feel lightheaded or dizzy. That's not just uncomfortable, it's dangerous. Falls are one of the leading causes of injury in older adults, and even a minor fall can lead to fractures, hospital stays, or long-term mobility issues. Research shows that some blood pressure medications, especially when combined with age-related changes in circulation, can increase the likelihood of these sudden drops in blood pressure. It's not that the pill is bad, but your age and how your body handles the medication can change the risk dramatically. This is why regular monitoring and honest conversations with your doctor are absolutely critical. Another important consideration is the effect on kidney function. Many blood pressure medications work by influencing how your kidneys filter sodium and water from your blood. For younger adults, this process is usually smooth and well tolerated. But as we get older, kidney function naturally declines. Combine that with medication, and you might start seeing changes in kidney performance without even realizing it. Sometimes this shows up as increased fatigue, swelling in the ankles, or changes in urination. Over time, if kidney stress continues unnoticed, it can contribute to more serious conditions like chronic kidney disease. What's tricky here is that the body often adapts gradually, so you might not notice a problem until it becomes significant. That's why lab tests and ongoing monitoring are so crucial for seniors on blood pressure medication. It's not about scaring anyone. It's about staying ahead and making sure your treatment is working safely. Electrolyte imbalances are another hidden risk that can sneak up on older adults. Electrolytes, things like potassium, sodium, and magnesium, are essential for nerve function, muscle contraction, and maintaining a steady heartbeat. Some blood pressure medications can cause your body to lose too much potassium or retain too much sodium, leading to a range of symptoms from muscle weakness and cramps to palpitations or irregular heart rhythms. These changes can sometimes feel subtle at first, maybe a little less strength when getting out of a chair or a fluttery feeling in your chest. Because these signs are easy to ignore or attribute to just aging, it's common for seniors to overlook them, but left unmanaged, electrolyte imbalances can contribute to serious heart issues or hospitalization. That's why, even if your blood pressure readings look perfect, it's worth paying attention to how you feel day to day and why routine blood tests are essential. Finally, let's talk about polypharmacy, which is a term for taking multiple medications at the same time, a situation many seniors find themselves in. When you're taking several medications for blood pressure, cholesterol, diabetes, or pain management, interactions can happen. Some medications can amplify side effects, while others can reduce effectiveness, making your blood pressure harder to control. For older adults, this is particularly concerning because the margin for error is smaller. Even a slight misbalance can trigger dizziness, fainting, or sudden changes in heart rhythm. That's why it's not just about what one pill does, but how all your medications work together. Your doctor should regularly review everything you're taking, not just the blood pressure pill, to ensure you're not putting yourself at unnecessary risk. Being proactive here is one of the most effective ways to maintain your independence and overall health, Now that we've gone over the research and the specific ways blood pressure medications can affect older adults, let's bring this into a real-life perspective. I want you to imagine someone like my neighbor, Mr. Thompson, who is 68 years old. He's active, enjoys gardening, and takes his daily walks around the neighborhood. On paper, his blood pressure looked fine, and his doctor had him on a medication that many seniors take routinely. Everything seemed fine, but over the course of a few months he started noticing subtle changes. He felt more tired after simple tasks, occasionally felt dizzy when standing, and sometimes experienced mild swelling in his ankles. He brushed it off at first, thinking it was just part of aging. But then one morning he stood up too quickly, felt a wave of dizziness, and nearly fell. That incident prompted a visit back to his doctor, where lab tests revealed slight kidney stress and an electrolyte imbalance issues that could have escalated into something much more serious if left unchecked. This story is a perfect example of how these medications can quietly impact older adults, even when everything looks fine in routine blood pressure readings. The key takeaway here is awareness. Your body is your best guide. If you notice small changes like increased fatigue, dizziness, muscle cramps, or confusion, it's worth paying attention. Don't just chalk it up to age. Keep a daily log if you can, noting any symptoms or patterns you notice. For example, does dizziness happen more in the morning, after walking, after taking your medication? These details are valuable when you speak to your doctor. And don't feel hesitant to ask questions. A good doctor will listen and work with you to adjust your treatment plan safely, whether that means changing your dosage, switching to a different type of medication, or incorporating lifestyle strategies that reduce your reliance on medication. Speaking of lifestyle strategies, here's where you have a lot of control. While medications are important, especially for high blood pressure, research shows that certain lifestyle habits can significantly support healthy blood pressure and overall well-being in seniors. Diet plays a huge role. Focus on whole foods like vegetables, fruits, lean proteins, and whole grains. Limit highly processed foods and excess salt, because too much sodium can exacerbate blood pressure issues. Hydration is another critical factor. As we age, our sense of thirst diminishes, so it's easy to become slightly dehydrated without realizing it. Dehydration can amplify dizziness and low blood pressure, especially in combination with medication. Staying hydrated, along with balanced nutrition, can help your body handle medication more safely and effectively. Exercise, when done correctly, is another powerful tool. You don't need to run marathons or lift heavy weights. Gentle, consistent movement is enough to make a difference. Walking, swimming, yoga, or light resistance exercises can improve circulation, strengthen muscles, and help your body maintain a healthy blood pressure naturally. The key is consistency and choosing activities you enjoy so that it becomes a lifelong habit rather than a chore. Exercise also improves balance, which reduces the risk of falls, a risk that particularly heightened when taking certain blood pressure medication. Pairing movement with good nutrition creates a foundation where your medication is less likely to cause unwanted side effects and more likely to work effectively in harmony with your body. Finally, stress management is often underestimated but critically important. Chronic stress can raise blood pressure and worsen other health issues. Mindfulness practices, deep breathing exercises, or even simple hobbies like reading, gardening, or listening to music can lower stress levels and help your cardiovascular system. For seniors, creating a routine that includes stress-reducing activities alongside proper diet, hydration, and gentle exercise can dramatically improve quality of life. It also reduces the pressure on medications to do all the heavy lifting. Think of it like this: your medication is a tool, but your lifestyle choices are the framework that allows the tool to work safely and effectively. Combining all these strategies, awareness of symptoms, communication with your doctor, proper diet, hydration, exercise, and stress management, creates a comprehensive approach that keeps you healthier and safer as you age. Now that we've explored real-life examples and lifestyle strategies, let's talk about some of the alternative ways to manage blood pressure safely for older adults, especially if you're concerned about the risks we've discussed. One of the most effective tools is home monitoring. Many seniors don't realize how valuable it is to track their blood pressure at home, not just at the doctor's office. Having a simple, reliable home blood pressure monitor allows you to notice patterns and fluctuations in real time. For instance, you might find that your blood pressure spikes after certain meals or dips in the mornings, which could indicate that your medication schedule or dose needs adjusting. By keeping a daily log of your readings, along with notes about how you feel, you empower yourself with information. This is crucial because it gives your doctor the data needed to make safe, informed decisions about your treatment. Alongside monitoring, it's important to regularly review your medications with your healthcare provider. Polypharmacy, taking multiple medications, can create interactions that increase side effects. Sometimes, adjustments like lowering the dose, switching to a different class of blood pressure medication, or staggering doses can make a big difference in how you feel. Older adults often benefit from what doctors call a medication reconciliation, which means reviewing every drug you take, including over-the-counter supplements, to ensure nothing is causing harm. This conversation can feel intimidating, but remember, your health is the priority. You have the right to ask questions and understand exactly why you're taking each medication and what risks to watch for. A proactive approach can prevent many complications before they start. Another critical tool is routine lab testing. Certain blood pressure medications affect electrolytes and kidney function, which aren't always noticeable through symptoms alone. Regular blood work like checking potassium, sodium, and kidney markers helps catch issues early. For example, if your potassium levels are off, your doctor might adjust your medication or suggest dietary changes to correct it. This isn't about creating extra worry. It's about being vigilant and ensure that your medication is helping you without causing hidden harm. Many seniors who take this approach feel more confident and empowered because they can see tangible data confirming that their body is tolerating the treatment well. Let's also touch on non-drug strategies that can complement your treatment. These include dietary approaches like the DASH diet, which emphasizes fruits, vegetables, whole grains, lean protein, and reduced sodium. Gentle physical activity is another cornerstone, including walking, water aerobics, or chair exercises for those with mobility issues. Mindfulness practices, meditation, and stress management techniques can all help stabilize blood pressure naturally. These strategies don't replace medication but can allow you and your doctor to use lower doses safely, reducing potential side effects. In fact, many seniors who incorporate these habits notice improved energy, better sleep, and even fewer medication-related symptoms like dizziness or fatigue. The goal is to create a balanced plan where your medication is part of a bigger picture of health, rather than the sole solution. Finally, it's essential to stay connected and informed. Joining a support group, whether online or in your community, can provide insights into how other seniors are managing similar challenges. You'll learn tips about lifestyle adjustments, home monitoring, and work with doctors in ways that you might not have thought of on your own. Knowledge is power, and when it comes to managing blood pressure safely in older adulthood, being informed is one of your strongest tools. Combine that knowledge with careful monitoring, lifestyle adjustments, and proactive communication with your doctor, and you significantly reduce the risks we discussed earlier. Remember, this isn't about fear, it's about empowerment, staying independent, and enjoying life while managing your health safely. As we wrap up today's discussion, I want to leave you with a few important takeaways that can truly make a difference in your health as you age. First and foremost, remember that blood pressure medications are not inherently bad, but they do come with potential risks, especially for adults over 60. Your body changes as you get older, and what was safe and effective a decade ago may not work the same way today. That's why awareness is your best ally. Pay attention to how you feel each day, and don't ignore subtle changes like dizziness, fatigue, or muscle weakness. These are signals from your body telling you that something might need to be adjusted. Small changes in your daily routine, like keeping a symptom and blood pressure log, can provide your doctor with the information needed to make safe, informed decisions about your treatment. Second, lifestyle choices matter more than ever. A balanced diet rich in fruits, vegetables, lean protein, and whole grains, along with proper hydration, can significantly support your blood pressure and overall well-being. Gentle, consistent physical activity, whether it's walking, water aerobics, or chair exercises, can strengthen your heart, improve circulation, and reduce the risk of falls. And don't underestimate the power of managing stress. Simple mindfulness practices, meditation, or hobbies that you enjoy can help stabilize your blood pressure naturally and improve your overall quality of life. These strategies are not replacements for medication but are powerful complements that help your body tolerate treatment more safely and effectively. Third, staying connected and informed is crucial. Regular check-ins with your healthcare provider, routine lab tests to monitor kidney function and electrolytes, and thoughtful conversations about your medications can prevent complications before they become serious. Polypharmacy is a real concern, so reviewing all your medications, including over-the-counter supplements, ensures that nothing is interacting in ways that could put your health at risk. Being proactive and asking questions isn't a sign of doubt, it's a sign of empowerment. You deserve to feel confident that your treatment plan is right for you. Finally, I want to leave you with a message of empowerment. Managing your health as you age doesn't have to feel overwhelming or scary. By paying attention to your body, making thoughtful lifestyle choices, monitoring your health, and maintaining open communication with your doctor, you can safely manage blood pressure, reduce risks, and enjoy a more active, independent life. Knowledge, vigilance, and small, consistent steps are the keys to living well over 60. Thank you so much for spending this time with me here at Primage Health Hub. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell so you never miss new tips on living your healthiest life after 60. And please share this video with friends or family members who might benefit from this information, because everyone deserves to feel safe and empowered when it comes to their health. Remember, it's never too late to take charge of your well-being, and a little awareness goes a long way in keeping you healthy, happy, and independent for years to come.